We were just talking on The Nerve the other day. There's a big documentary about the artist Billy Joel that's airing now on HBO, and he and his sister refer to his mother, who had rage explosions like this, and they describe their childhood as, quote, walking on eggshells, as bipolar. And I think there's a lot of confusion between what a bipolar mother presents as and a borderline mother presents as. Is there much of a difference, Sam?
Yes, of course, there's a huge difference.
Would you explain?
Bipolar disorder is cycling between moods, and the cycles take a very long time. Typical bipolar cycle is weeks to months. Months is very common.
Whereas manic versus depressive?
Manic versus what used to be called manic depressive, yes. Hypomanic and manic. While in borderline personality disorder, the cycling is very, very fast. It's accelerated. Like the borderline can switch between moods within the hour or within hours. It's extremely rare to document a case where a mood lasts for 4 days. That's considered to be an outlier, something amazing. So that's the first difference. The second difference is everything that is happening to the bipolar is an outcome, a direct outcome, and a result of the underlying mood disorder. Whereas in borderline personality disorder, the mood disorder is ancillary, is not a main clinical feature. There are other clinical features which are much more relevant in borderline and which are completely absent in bipolar disorder. Anyone who confuses the two is a bad clinician, to use a British understatement.
But if you're a child or an adult child, what is absent in the bipolar mother that is present in the borderline, or vice versa? What behaviors?
The bipolar is predictable.
Okay.
You know that father right now can't sleep, is into harebrained schemes of getting rich quick, so that's a manic phase. And for sure as a child that the next phase is father goes to bed and never leaves bed for a few months. So it's utterly predictable. The cycling is predictable. Whereas with a borderline mother, there's no way, there's no model, there's no theory you can construct which will predict the mother's future behavior. And we say that when you are with a borderline mother, there is a failure of what we call theory of mind. There's a failure of mentalization. You cannot create a theory about your mother's mind which would allow you to feel safe, to feel that you are in a secure base. And that is terrifying for a child. It's a horror movie.